Bunions are not merely cosmetic, they signify a misalignment in the big toe joint affecting foot structure. The visible bump is just the surface issue. Beneath, the big toe shifts, impacting comfort and mobility. Advances in imaging and surgery now allow for precise diagnosis and treatment, improving patient outcomes. Bunions are one of the most common foot problems people deal with every day. But here is the important thing to understand. A bunion is not just a cosmetic bump on the side of the foot. It is usually a sign that the big toe joint has shifted out of proper alignment. Hi there, I'm Dr. Faranak Pourghasemi. I have been practicing podiatry for 20 years in Los Gatos, California, and I'm delighted to deliver this first SmartTechCheck EduSeries as a contributor on this very important medical topic. My goal is to make bunions easier to understand, less intimidating, and more manageable. When patients come into my office, many say, "I thought this was just from wearing the wrong shoes." Sometimes shoes play a role, but bunions can also be genetic, related to foot structure, affected by health conditions, or triggered by injury and pressure over time. The good news is that we now have better tools, better imaging, and better treatment options than ever before. Technology is helping us understand the foot more clearly, measure the problem more precisely, and personalize treatment in a way that fits the patient's lifestyle. So let's start with the basics. One of the most common questions patients ask me is, "Why did I get this bunion?" And the honest answer is that there is usually not just one reason. For some people, bunions run in the family. That does not mean you inherit the bunion itself. It usually means you inherit a foot type or joint structure that makes the bunion more likely to develop. For others, medical conditions can contribute. Arthritis, inflammatory conditions, ligament looseness, or other internal factors can affect how the joints behave. Then there are external causes. Shoes that are too narrow, high heels, repetitive pressure, trauma, or years of standing and walking can all place extra stress on the big toe joint. This is why I always tell patients not to blame themselves. A bunion is not a character flaw. It is not simply the result of one bad shoe choice. It is a mechanical problem in the foot that deserves a thoughtful evaluation. And this is where modern podiatry has improved. We no longer have to guess based only on what the foot looks like from the outside. We can use imaging, measurements, and gait evaluation to better understand what is happening beneath the surface. That matters because the cause should guide the treatment. The visible bump gets most of the attention, but the real issue is usually alignment. Alignment simply means how the bones line up when you stand, walk, and push off with your big toe. In a healthy foot, the big toe joint should help carry weight and support movement. But when that joint shifts, the big toe may begin leaning toward the smaller toes. At the same time, the first metatarsal bone, which is the long bone behind the big toe, may drift outward. That creates the bump. But it can also create pain, stiffness, swelling, redness, and trouble wearing normal shoes. Some patients also develop pain under the ball of the foot because the pressure shifts away from the big toe joint and onto smaller joints that were not designed to carry that extra load. This is why treating only the bump is not enough. We need to understand the mechanics. Technology helps here. Weight-bearing X-rays, 3D imaging, and pressure studies can help us see how the bones behave when the foot is actually supporting your body. That gives us a better picture of the problem and helps us avoid one-size-fits-all treatment. Not every bunion needs urgent treatment, but there are warning signs that should not be ignored. If you have pain when walking, trouble finding shoes, swelling around the big toe joint, numbness, stiffness, or the toe is visibly drifting more over time, it is probably time to get evaluated. Another important warning sign is pain under the ball of the foot. That can mean your foot is compensating. In simple terms, the foot is shifting pressure away from the bunion area and placing it somewhere else. That may seem minor at first, but over time it can create new problems. I also want to say something reassuring. Seeing a doctor does not mean you are automatically heading toward surgery. Many patients come in because they are afraid they waited too long, or they think surgery is the only solution. Often, we can begin with conservative care and monitor the bunion over time. But waiting until you cannot walk comfortably is not ideal. The earlier we understand the problem, the more options we usually have. Technology helps us track changes and make smarter decisions before the condition becomes more limiting. The goal is to protect your mobility, comfort, and quality of life. For many patients, conservative care is the best place to start. Conservative care simply means treatment without surgery. This can include wider shoes, shoe modifications, padding, custom inserts, anti-inflammatory medication, icing, stretching, activity changes, or physical therapy. The goal is not to magically erase the bunion. The goal is to reduce pressure, calm inflammation, improve comfort, and help you keep doing the things you enjoy. One of the most useful tools we have today is digital foot scanning. Instead of guessing where pressure is happening, we can often create a more precise picture of how your foot meets the ground. That can help us design better orthotics, which are custom shoe inserts that support the foot and redistribute pressure. Some patients also benefit from gait analysis. Gait means the way you walk. If your walking pattern is placing too much force on the big toe joint, we want to know that. This is where the technology angle becomes very practical. It is not technology for the sake of technology. It is technology that helps us make better decisions for real people with real pain. And for many patients, that can delay or even avoid surgery. Modern podiatry is becoming much more precise. Years ago, we relied heavily on what the foot looked like, where the patient felt pain, and standard x-rays. Those things still matter, but now we have more advanced ways to evaluate the foot. Weight-bearing x-rays are especially important because they show what happens when you are standing. That matters because a bunion may look different when the foot is carrying body weight. 3D imaging can give us an even deeper view of bone position and joint rotation. Pressure mapping can show which parts of the foot are carrying too much force. This is helpful because pain is not always located exactly where the real mechanical problem begins. Digital gait analysis can help us study how the foot moves during walking. For patients, this can be very empowering. Instead of simply hearing, "You have a bunion," you can see why it is happening. You can understand whether the issue is mild, moderate, or severe. You can also understand why one treatment may make sense for you, while a different treatment may be better for someone else. That is the future of foot care: more precision, more personalization, better conversations. Surgery is never the first conversation I want to have with a patient, unless the situation clearly calls for it. But sometimes surgery becomes the better option. That may happen when pain continues despite conservative treatment, when the toe keeps drifting, when the joint becomes unstable, or when walking and daily activity become difficult. Here is something important to understand. Modern bunion surgery is not usually about shaving off a bump. The real goal is to correct the alignment of the bones. That may involve cutting and repositioning bone, stabilizing the joint, or correcting the deformity in a way that helps the foot function better. The specific procedure depends on the severity of the bunion, the shape of the foot, the patient's age, activity level, bone quality, and overall health. This is why the evaluation matters so much. The best procedure for one patient may not be the best procedure for another. Technology is helping surgeons plan more carefully. Image and measurements allow us to see the angles, rotation, and instability more clearly before surgery. That means the surgical plan can be more thoughtful and more personalized. The goal is not simply a straighter toe, the goal is a more comfortable, functional foot. One of the most encouraging developments in bunion care is the rise of less invasive treatment options. You may hear the term minimally invasive bunion surgery. That means the surgeon may use smaller incisions, specialized instruments, and imaging guidance to correct the bone position with less disruption to the surrounding soft tissue. For the right patient, this can be very promising. Smaller incisions may mean less scarring. Less soft tissue disruption may help with comfort and recovery. Imaging guidance can help the surgeon make precise corrections through a smaller opening. But I also want to be very clear. Minimally invasive does not mean minor. It is still surgery. It still requires careful planning, proper technique, and a recovery period. It is also not the right solution for every bunion. Some bunions are too severe. Some joints are too unstable. Some patients may need a more traditional correction to get the best long-term result. This is where patient selection becomes critical. The exciting part is that patients now have more options than they did years ago. The smart approach is not asking, what is the newest procedure? The better question is, what is the right procedure for my foot? Technology is also changing what happens inside the operating room. During bunion surgery, imaging guidance can help the surgeon confirm bone position and alignment in real time. Specialized screws, plates, and implants may be used to hold the corrected bone in place while it heals. These devices are designed to provide stability, which is important because bone healing takes time. In some cases, advanced planning tools can help the surgeon map out the correction before the procedure begins. That planning matters because a bunion is three-dimensional. The bone may shift outward, rotate, and change the way the toe functions. A strong surgical plan has to account for more than what we see on the surface. But technology is not the hero by itself. The surgeon's judgment still matters most. Technology gives us better information, better tools, and better ways to confirm the correction. But experience, training, and patient communication remain essential. For patients, this should be comforting. The goal is not to rush into surgery. The goal is to use the best available tools to make a careful, informed decision and, when needed, deliver a more precise correction. Bunion treatment isn't one size fits all. Some cases improve with non-surgical methods while others need surgery. Precision in diagnosis and personalized treatment is now achievable with advanced technology. Patient here is the most important takeaway. Every bunion is not the same. Some bunions can be managed very well with shoe changes, padding, orthotics, therapy, and careful monitoring. Others may need surgery because the structure of the foot has changed too much, or because pain is interfering with daily life. The mistake is assuming there is one simple answer. There is not. The better approach is to understand the cause, measure the severity, review your lifestyle, and choose a treatment plan that makes sense for you. Technology is helping us do that better than ever. We can evaluate alignment more precisely. We can study pressure and walking patterns. We can use improved imaging. And when surgery is needed, we can plan and perform corrections with more accuracy. But the heart of good care is still the relationship between the doctor and the patient. You deserve clear explanations. You deserve options. You deserve a plan that is built around your life, not just your x-ray. Thank you for watching this SmartTechCheck EduSeries episode. Please like this episode and leave a comment with your questions or thoughts. And if you would like to discuss your specific medical situation with me, please use the on-screen QR code for my contact details. The right level time is crucial. The right procedure depends on thorough evaluation. The ultimate goal is comfort, activity, and quality of life, tailored to individual needs.